Honorable Akol.
Right Honorable Speaker, I have forgiven the Right Honorable Speaker for intimidating, Prime Minister for intimidating me. And Right Honorable Speaker, it is not the first time. She has refused even to take photos with me several times. I have to raise this. Right Honorable Speaker, I have a matter of national importance, and it touches on the lives of the people in my constituency. I have been following on this case from Tuesday up to today. There has been an outbreak of cholera in my constituency.
Prime Minister, do not allow to take a picture with Akol. Please.
Right Honorable Speaker, from 2nd of July of 2025, up to now, the reported cases are 143. And so far, 11 people have died in Elegu Town Council in my constituency. I visited the area myself, and the team is really very frustrated because they lacked a lot of facilities to make sure they can rescue the situation. They don't have finances. There is lack of medical supplies in the place. Apart from that, the area has inadequate staffing, no financial support, as I said before, but above all, there is no medical facility in the place. In 2020, government started building Health Center 3 in Elegu Town Council. Up to now, it has not been, the construction is not finished, and even is not operational. Now, my prayers immediately, which is very important for the Ministry of Health to pronounce itself on this outbreak, because people are suffering. Imagine from 2nd up to now, if we've lost 11 people. And above all, they are worried about the water sources that need to be tested, because they are not sure whether this problem is coming from the pipe water or the other sources of water in the area. And also there is need for treatment center to be, made in the place immediately. And above all, the health facilities in this area, there need to be more staffing, especially in BBR Health Center 3, so that they rescue the situation. But also want to understand why the Health Center 3 of Elegu up to now has not been finished the construction and even not operational up to now. Right Honorable Speaker, thank you very much. I really need this issue to be rescued. The situation is bad, and I want to thank Prime Minister to at least have given me the opportunity to raise it. Thank you very much.
Thank you, Prime Minister, and thank you, Honorable Akol. Honorable Jane Ruth.
Right Honorable Speaker, allow me to thank the Honorable Member for the question. And we hear his cry. But allow me to inform Honorable colleagues that cholera is a sanitation issue. And sanitation is not Ministry of Health alone, it is multisectoral, including the people of Elegu. We only come in when the disease has already broken out to control. And Right Honorable Speaker, my teams have been on the ground in that area. The water testing is being done by Ministry of Water. We work in collaboration. They do the water testing. But of course, water is also a challenge in that area. The supplies is requesting for, we already dispatched. And it has been there because this outbreak is nearly coming to 2 weeks. It is not a new thing. And it will be controlled soon. We always control these outbreaks. It is not a scare for us. The issue of the Health Center 3, Right Honorable, I need to follow it up and find out why the construction stalled. I can't remember offhand. I will do that. But I want to reassure him that we shall control the outbreak, but also appeal to him to continue talking to the people, because cholera is an orophycal issue. Hand, mouth, feces. They need to wash hands. Right Honorable, I thank you.
Thank you. They need to wash hands, they need to boil the water that they are drinking and make sure the sanitation is good enough. And as leaders, let's communicate to our people. But since the people are dying, you really need to come in and support on those who are already sick. So you need to support them to make sure that we don't get more death. Thank you.
Honorable Speaker and honorable members, before I answer my question,
you can now go.
Before I answer my question, I wanted to inform Honorable Akol that I have never feared taking a photo with him. After our interaction today, we can go and take as many in any place of his choice.
Honorable Prime Minister, that's an open invitation.
That Honorable Speaker and members, that was, you know, he's too tall. So people who are short like me, when you take a photo with him or him, you will look like a dwarf. So, in a brief, he should prepare a stool.
Yes.
Right Honorable Speaker, the issue I'm raising is about Nusafa 4. Right Honorable Speaker, as I'm aware, the World Bank approved the Nusafa 4 to have started in July. But Right Honorable Speaker, I have talked to the chairperson of National Economy and nothing has been presented to the Parliament for approval, as we really sub-regions that are supposed to benefit from Nusafa 4 are suffering. Right Honorable Speaker, we have been together with the work members of Parliament and are getting a lot of questions. This is members of Parliament from West Nile, Acholi, Lao and Karamoja. We want to find out from Right Honorable Speaker, when is the loan going to be presented
From the
to
Right
Parliament
Honorable
for approval?
Prime Minister.
I mean from Right Honorable Prime Minister, when is the loan going to be presented to Parliament for approval? Thank you.
Prime Minister.
Right Honorable Speaker and honorable members, I chair the committee that approves loans for government. We are done with all the processes. The paper is ready for cabinet consideration, and then we shall bring it on the floor of Parliament.
Thank you. And even those who have already renewed, how long does it take for one to get the ID?
Right Honorable Speaker and honorable members, I received a similar complaint with my constituents. And then what we did, we laid a trap using the police and arrested a few. So in my district, that has died a natural death. They were not giving our people the forms. They would tell them the forms are all over, but we need money to go and photocopy. 10,000, 20,000, depending. And when they would identify that these people look like Bavandimwe, then they say, for you are not supposed to get, but we are helping you, 100,000. And so we only need to be vigilant as leaders, but also I will request that the Minister of ICT and National Guidance will give the country, because I can see it is almost everywhere.
Yes.
He will give a statement to the country and guide so that the country is helped.
Yes. Yes.
Right Honorable, there are two issues on this particular issue of NIRA. Because the charges we are talking about is when you have lost your identity card. And that is when you are supposed to pay 50,000. And then in a situation where you are replacing, there is no payment. Now the question at hand is, people cannot afford to pay the 50,000, and many people are failing to replace their national ID. And I think this another issue that on the NIRA renewal. which is very important that Prime Minister try to deal with it, please. Thank you.